focus on the lower back. We're gonna pay attention to the interaction between the hips and the ribs. Those are the two bony structures that we're focusing on with this movement. So we're gonna let the bands support most of your body weight. And so you're just leaning forward, letting your upper body, upper torso just hang into the band and use the bands to really support you. And then bending at the waist, we're gonna explore a position. The whole time we're searching for where you're most restricted, where you have the most tension. So as you go into that forward bend, if you're moving your femurs back and forth within the hip joint, if you're exploring the tripod of your foot and the ankles, how your tibia relates into the knee and the knee to the hip, that whole kinetic chain, which is what we always talk about, we're going to be focused on how do we isolate the area that feels most restricted and floss it. So we want to bring high repetition movements, 25 plus repetitions, into a specific area where that anatomy has the restrictions, where those muscles that connect to the bones are most restricted. We're going to do small little micro flosses there, and the whole time you're focusing on letting go. Challenge where you're feeling that tension within the skeletal system, so we can bring some blood flow into that part of the body. Explore the spine, your lats and that whole lateral side and how it connects into the hip. And you can play with the foot position. So if you shift your feet in different positions, explore what that feels like within the hip joint. And we really are exploring, we're trying to explore where do I feel tight? Where do I feel restricted? What is going on in my hips and in my femur? And you know, everyone's different and everyone's gonna have all kinds of different levels of mobility and flexibility. So Megan is our model that we're using to illustrate the movements, but you're not trying to match Megan's mobility. You're just simply finding what works for you in this movement. Okay, so in that position, so it takes that level of extreme to feel the muscles that you're tight in. Mm-hmm. Okay, so go into that position, and then I want small little micro movements, exactly, like getting the femur to move any way you want within that position to challenge where you're feeling that tension within the skeletal system, so we can bring some blood flow into that part of the body. And so say just find one position, Megan, that feels like has more tension.
That'd be this one.
Okay, so in that position, so it takes that level of extreme to feel the muscles that you're tight in. Mm-hmm. Okay, so go into that position, and then I want small little micro movements, exactly, like getting the femur to move any way you want within that position to challenge where you're feeling that tension within the skeletal system, so we can bring some blood flow in. And then with that left at the plant, you can just play around with how that femur is driving into that hip. So now there's no stress on this side, so this side is doing all the work. So now within that position, the foot's light, you've loaded the left side. Explore what rotating that right leg feels like. You know, exploring what that feels like to put that femur into a different position while you're supporting yourself dynamically. Hold, really settle down as deep as you can. Hold a position and kind of let yourself shift a little bit. How far down can you go with that? Is that it? Okay, good. So play around there. So we want to go to your limit, your range of motion's limit, and then explore that. So just see how that right hip can open up, holding a position. And so in this position, we'll do the 25 reps. So go down deep, and now in that position, I just want just small little rotate the pelvis, you know, or rotate the knee, you know, or rotate the upper body with something within the knee, within the femur, the hip, and the torso. 25 times. 2, 3. Now we're going to see if you drop down. Keep going. 4, 5, 6. So the idea is we are flossing the hip joint. So we're letting her upper body and most of her weight use the bands for support, so there's not any stress going into the hip. So as she moves, we're really making this as gentle as possible for her, so there's not hardly any stress in the right hip, and all the work is being done by the bands in her upper body and that left leg. And then we're just asking, how much can we let go? How much can you relax deeper into it? Good, good, good. That's a good 5 degrees deeper range.